I want to move on to our next guest, who continues to have a very positive outlook on life despite going through a very negative experience. This is Kimberly's story.
Almost 1 year ago, I was on a motorcycle ride with my new boyfriend. We were riding all day around the California coast. The sun was out, it was beautiful, and we were involved in a horrific motorcycle accident. I woke up laying across the roadway. Everything hurt, and I couldn't move. I remember the sound of a helicopter. We were airlifted out of the canyon and taken to UCLA Trauma Center. My femur was shattered and my femur broke my knee. The majority of my skin came off my right arm and my right shoulder. And my glasses hit so hard on the bridge of my nose that it has changed the shape of my nose. When I look in the mirror, I see a bump, and I'm acutely aware of the accident happening over and over and over. I don't see the lighthearted girl anymore. I'm grateful because it could have been worse, but what would make me happy is if I could look in the mirror and not have the constant reminder of the accident. I want to move on. I want to be better.
Dr. Ordon's with Kimberly back in our procedure room. Also with her doctor, board-certified dermatologist, Dr. Jason Emer. Take it away, Dr. Ordon.
Thank you, Travis. Welcome back, Jason. And Kimberly, welcome to the show. And you're in good hands here to fix you up after that accident. I think Kimberly is an excellent candidate for so-called non-surgical nose job or filler rhinoplasty. Dr. Emer, tell us what you're going to do.
Well, I'm planning to use a little bit of a hyaluronic acid filler, which is a sugar-based filler, to kind of rejuvenate her nose, because then her nose reminds her of the accident. And I figured we can do this instantly and give her a good result almost dramatically, and she'll feel much better about herself and stop thinking about that accident so much.
So let's get going right here.
We're going to start using the treatment here, and I'm just going to follow her bump and do a few injections along the bone. And you can see immediately the tissue will rise. And what we're doing here is just putting a little bit of volume above and below. Very little pain.
So this is camouflaging the bump. The bump is in the middle. By adding filler above it and below it is going to create a straight profile.
And what's nice about this is, again, avoiding the need for surgery.
And depending on the filler, that determines how long this will last, right? Anywhere from 6 months to 2 years,
we're using an HA filler here, which, you know, in the nose lasts longer because it's not as dynamic. It's not moving as much, for example, as your lips are around the mouth. So in the nose, we do get a longer result than some different areas. You can use other fillers. Radiesse has been used. I agree with Dr. Emer. I like HA products, hyaluronic acid.
And I think that also what's really important for people watching this, just because you're a healthcare provider and you know how to use an injection and a needle does not mean you should be the one applying these kind of fillers to the face. This is really board-certified dermatologist, board-certified plastic surgeon. You need to know the anatomy. You need to know how these fillers work and behave. And
yeah, and we're going to actually talk more about that because we're going to share Kimberly's result later in the show while Dr. Emer continues his work with her.
she's smiling already.
That's always a good sign.
Yeah.